Hi friends, today we will discuss one of the important things in nursing ethics, that is called ethical principles. This is very important and I have seen many questions coming from ethical principles based on any of these ethical principles and questions, and some of us have still doubts related to this topic. So we'll see one by one. Basically we have six ethical principles. That is, the first one is autonomy, then fidelity, then justice, then veracity, then beneficiaries and malifications, and also confidentiality. Also it's related to the ethical principles. So we'll see one by one. Just concentrate and listen clearly, because some of these ethical principles are frequently coming in many of the nursing comprehensive exams. So make it a clear idea, and also this is going to help when you are in an ethical dilemma in the clinical settings. We might have been taking care of many clients in the clinical settings, and sometimes we might be in a dilemma. What should I do? Okay, this is the circumstances. From the patient side, that is right. From my side, I am right. So what I supposed to do? What is the right thing I should do? So if you know this ethical dilemma, if you know these ethical principles, definitely you are going to solve such confusions. So we'll see one by one. The first one is autonomy. See, the word autonomy, it is equal to freedom, which means respect for an individual's right to self-determination. Every individual, every client have the complete right what they wanted to do. We should respect the self-determination. For example, a client who is coming from a Jehovah community or a Jehovah Witness, according to their religious belief and their concept, receiving a blood or blood components, it's against to the belief what they are practicing. So as a healthcare professional or as a nurse, you might recommend and you might suggest your hemoglobin is this much low, you're supposed to take this blood transfusion and this and that. But I should not compel. I don't have the right to compel or tell to the patient, client, that you're supposed to take that, you should undergo for the blood transfusion, you have to receive the blood. No, we should respect them. They have the right to refuse or to receive, whatever it is. Something might be good or something might be, if she didn't receive that particular blood or something going to happen, but even though we should give the priority for them. So that is called the autonomy. That is the freedom or a person to right to take their own decision. That is. Then the next one is called fidelity. So fidelity, we'll see what is the meaning of fidelity. It's simple, very simple. See, if I give a word to a person, I should promise. If I should promise or I give a word, I should follow that. I should do that one. For instance, okay, today you have 5 patients. You're working in a medical surgical department and you have 5 patients, and out of that one patient, she's not that much stable and she's receiving some transfusions, and another patient has some infusion, and also we are a little bit busy. And one of your patients, she's a chronic condition and her dependency level is 4, and she want or her dependency level is 3 or 4, and she want you to help or assist her for changing her dress or doing some positioning, or she want to sit for a while, or some kind of help she need from you. And you are very busy with your other 2 unstable patients who is receiving transfusions and who is receiving some kind of insulin infusions and all. Okay, and you told to this patient, this chronic patient, that I am a little bit busy right now, I will connect that infusion and I will be back within 2 minutes. Is that okay for you? Okay, that chronic patient, she accept. Okay, she told, okay, it's fine, you just take 2 minutes and I hope that you will be back within 2 minutes. And the client, she's waiting or he's waiting. You went to the another patient bedside and you found something miserable and unusual, and the IV cannula is not, the access is not good, and the transfusion is not going good, and you have some issue. And what happened? You didn't reach the another third chronic patient within 2 minutes. It's been now 5 minutes. You didn't reach. What you did? Did you follow the promise? Did you keep the promise? No. The duty what you did, it's against the word that you gave to that particular patient. So this is the scenario. If a nurse, she should follow these ethical principles, which means if she said to a client that I will be back to within 2 minutes, or I will ask to the doctor what medication you're supposed to receive this time if you have too much pain, if whatever we will inform to the client, we should keep in our mind that the Fidelity rule says that we have to follow that particular within that time frame, and we should ensure that I follow the word what I gave to my client. So that is called fidelity. I hope you're clear. So next we will move to veracity. What is means veracity? Like always you are straightforward. You should say the truth. Veracity is equal to truth. Just keep it in your mind that veracity is equal to truth. The obligation to tell the truth, that is called veracity. For instance, okay, you are working in an emergency department. You might have like hundreds of patients, or like 10 or 50 patients, and all of you and your colleagues are very busy with the patients. And one client, she said to you that when you approach that client for giving an oral medication, she is a little bit stable now. Now she can transfer to ward, or her observation period is going to complete. You want to give a tablet. You approach to the client and you said to the client, okay, this is the tablet and this is for this particular action, and you just take the water in your hand and the tablet you wanted to give. But the client said, sorry, now I'm not feeling to take this one. Would it be okay? I will keep this medication with me. I will not tell to anybody. If you are okay, might be this staff, she's going to finish her shift. Okay, no problem. I am saying I will take. Don't tell to anybody. Don't tell to the one who is sitting beside her as her bystander, or whatever it is. Just keep it for me. Just leave it, or I will do, or something like this. She is telling you to do a mistake. See, this is a mistake, right? Actually, you're supposed to give the medication. The patient, she don't want to give medication. I should return the medication, and when I am giving the handover or endorsement to the next staff, I should tell that actually I approached this patient like this and like this, and she don't want this one. She told she will keep, but I told it's not possible. It is not the right way to do. So you just ask to the patient after 10 or 15 minutes, and you do the appropriate measures. This is the way you're supposed to do. But if you are not doing in this way, and you are accepting with the client that okay, no problem, you keep it, you hide this medication and you take later, are you following the rule of veracity? No, you are not following. You are doing something wrong. If in a situation you come in this scenario, you should think about the rule. Okay, this is the principle, veracity. Okay, I should keep the I should, like, I am obligated to tell the truth. I should not hide anything. So this is called veracity. Then next we will move it to justice. So what do you mean by justice? All of you know that in every part of the world the people are working, they are doing strike, everything for the justice what they deserve from their government or from the community or from the other people. So the justice in medical or in nursing ethics that is the equitable distribution of potential benefits and task determining the order in which clients should be cared for. See, here the word is equitable distribution, which means every client who is admitted or who is in front of you have the equal right to receive all the deserved care. For instance, a client who is different from a community which is not good, or the community who is doing something against for the some of the good people, those who are in the society, and based on those concepts you may not be don't like that community people, and now this person is your client, and you are the assigned nurse. You want to take care of this patient. Based on their previous activities in those community, you have a bad concept about these people, and you are not delivering the equal care. What you are doing, you are doing, or you are violating the principle of justice. Whatever it is, the client is coming from a different gender, or the client is from a different race, or the client is poor, or the client is rich, or the client is illiterate, is not educated, or the client does not have the proper personal hygiene, whatever it is, if the client is admitted in the hospital and you are an assigned nurse, you should follow the principle of justice. You should deliver all the care in an equal manner. Every client have the right to receive that care. Every client should deserve that from a healthcare professional. So are you clear what is the meaning of justice? Then now we will move to beneficiaries. Usually I have seen many questions coming from these topics, beneficiaries and malifications, because these two topics a little bit confusing. Most of the time when we see scenario you might feel, oh, is it the beneficiaries or is it the malifications? So that's why I think the questions are coming from this principle. The beneficiaries, it's called the duty to do good to others and to maintain a balance between benefits and harms. Paternalism is an undesirable outcome of beneficence, in which the healthcare provider decides what is the best for the client and encourages the client to act against his or her own choices. See, in the beneficence, see the word itself says that something benefit. So who is going to receive this benefit? Definitely the client is the one who is going to receive the benefit in this scenario. Might be some client, he or she don't want to follow a proper personal hygiene measures that you are carrying out in this clinical setting. She is coming from a different area or a tribal community, and the personal care practices that she is following is entirely different. So when you want to do that one for the client, she might be against you. She might be not allowing you to do that particular task the way that you will do, because from their tribal community or from their community they have certain styles and customs. That is the way they are following. So when you wanted to do this alcohol swabs or something, they will tell, no, it is against, or it is not good, this is going to harm my body skin, or something like this they say. But in this scenario you should think about the beneficence principle. See, what are the things you are taking, that is you are doing for the good of the client, that you should ensure that, okay, this I am doing because the client should receive the perfect and accurate and a good result from what I am doing, from the task what I am doing for the client. So sometimes the client, she may not be accept, but that time the word here is called paternalism. Like, you know that in some countries they will give paternal leave, the father. Like, see, a father always take care of their daughter and sister, daughter and the son. And even though the son maybe he don't wanted to go to school, definitely the father tell, no, this is not good, you're supposed to go to school, then only you will study. In the same way, the nurse should act as a person, should encourage this client. Okay, I understand that you are not following this way, you are following in another manner, or this is your custom, but what I am insisting or what I am encouraging you to do, it's for the benefit of your health. It's going to give some kind of good result in your health aspect. So this is the way you have to encourage, you have to convince the client. So that is called the beneficence. Then next we will see non-maleficence. What is mean non-maleficence? Like, you should do good things to the client, but at the same time you should ensure that I am not doing something harm to the client or harm to another person. Like, sometimes you are providing some care and your intention is good, but at the same time you are adding something that might be leads to a harmful effect on the client, you should not do. So this is the principle, non-malifications. You are doing good, and along with that you should ensure that I am not doing anything, or what are the things I am doing not going to happen anything harm on my client. So that is the non-malifications. In beneficiaries we told we are doing the good, and we are trying to encourage, and we are trying to convince the client to receive that good thing for their health. And here in non-malifications we are doing good, but at the same time we should ensure that I am not doing anything harm to the client. Are you clear? So these are the 6 main principles of ethics, and we might have received some questions. Even you are not a person who is preparing for any questions or exam, then also you should understand this one, because in everyday clinical settings we might have come across with any kind of this ethical dilemma. So if we are 100% sure about these principles and topics, I am assured that you can act as an excellent and well-licensed professional in your healthcare settings. So be happy, prepare all these topics and update your knowledge. If you want more clarification, if you want to practice more questions based on these topics, please inbox, please just send mail to me. I will try to make some more questions and some more additional clarification. So bye bye, take care.